Hi. So, in this video, I want you to explore that line that differentiates between normal and not so normal behavior or emotion. So, as in, like, what is harmful for you that can cause you harm in the longer run or to people around you. So, how do we know that this is okay and we can carry on with it, and here I need help? So, let me share a very small story with you. This story is about a girl let's call her Nancy. So, Nancy feels that something is not okay with her. Although she's going on her job and meeting her friends and everything, but somewhere deep within herself, she knows something is not okay. There is some kind of heaviness. So after some time has passed, she goes and talks to her mom about it, and she says, Mom, maybe I think I'm feeling depressed or something, and I need to consult a professional. So her mother says, Oh, what nonsense, is nothing like depression. You just take 2 days off, maybe you're a little stressed out, you take a break, and you'll be fine after some time. Talk about it or something. So so this way. So Nancy says, okay, maybe I should give it more time. So now she has given some time already. Her mother says to take a break. Now she has a friend called Ruchi. Okay, that's it. So she has had a recent breakup. Last week she had a breakup and she's feeling sad. So Ruchi also comes to Nancy and she says, I think I am really depressed after this and I need to take help. So now what I want you to notice here is there is confusion in Nancy's mind as to whether am I like qualified, and is my problem that much important to go and seek professional help, or like Ruchi, I am also just going undergoing some phase and it will be fine after some time. What should I do? So these type of confusions are there, and I'm sure most of you may be relating to this. So now how do you know? So first of all, I want you to understand that like Ruchi, we are humans and we are experiencing a lot of things. So negative emotions are also normal. Okay, if you are having fear, it's not anxiety disorder. If you're having whatever, so these are negative emotions that need to be felt. If you are feeling sad, suppose you had a recent death in your house, so you need to feel sad about it. You'll obviously be sad, and how long, that varies. Some people might move on early, some people might take some time. So now the question here is, how much time? Where is that line where you need to decide that, okay, now here I can't handle it on my own, I don't think that this is helping, and if I drag on with life, it might increase rather than reducing. How do we know that? So here are uh, some signs that you need to consider. The first thing is, if you feel that something is not right, so my dear friends, definitely something is not right. Your friends might say, okay, what is the issue? You have a good family and you have a nice job. What is it? But there must be something. There must be some underlying conflict in the subconscious mind, or maybe you know what the conflict is but you don't know what to do about it, so you just put it off and you're avoiding life. You want to just sleep throughout the, you just want to, that's why you start sleeping more, because you don't want to face your life, because then you'll have to face that conflict as well. So you just drag on, or maybe you don't know what the conflict is, but definitely if there is an issue, you can take help and resolve that conflict and you can feel better. So second thing is, if that issue is so much that it is impairing with your work, like for example, everybody feels fearful before the exam or before an interview. So you get a lot of thought, what will happen, what will be the question paper like, and all that. Now if your fear is so much, you have thought about your future so much that you are paralyzed, you just freeze before an interview, you are not able to sit for the exam, you are not able to go to the interview, you are not yourself. In that case, you're not doing your work properly, you're not able to express yourself properly. Here there is an issue. So now here it is not like normal kind of fear, because now it is impairing with your occupational life. It can impair your social life. You can't go around with people. So in this case you need help. Now the third thing is, if you are having suicidal ideations, like I said, in case maybe like in case of Nancy, she says she just feels like sleeping and she hopes that perhaps she would die in her sleep, that way. So maybe you have not acted, you have not attempted suicide, but you have had some ideations, you have contemplated, or maybe you have attempted. In that case you are putting your life in danger, and also maybe you are putting, because of that mental stress and all, you might put somebody else's life in danger too. Here you need to take help. Now, the fourth thing is, it is slightly confusing. Like you may be minority, you may be 1 in 100. So you, in your culture, that is considered abnormal. But for you, like you don't know what to do about it. For like you are simply different from others. Now, is it abnormal? So, my dear friends, minority is not abnormality. But what happens is, when you are a minority, you might not know how to deal with it. So, your difference, if you are not able to handle that difference well, then that can cause you problem. If you know you're different and you are okay with it, you're going on your work fine, you're working properly, having socializing, and you're happy with that difference, then it's okay, you know how to deal with that difference. But sometimes you are different and that can make you feel lonely, that can make you feel isolated socially. You don't know, like you're not getting friends, you're worrying about your future and all. So here it is giving you issue. So here deviation from the society, being different, can be a issue in this case. Then also you need to take help. So here, like if you yourself feel something is not right, you are not able to work properly, that issue is interfering with your work, your it is cause putting you in danger, it is also deviating you maybe. So these things can be considered that now you need to take help. Otherwise, whatever you are, whoever you are, if you are happy with yourself, you are going on well with life, it's okay. Negative emotions are okay, you don't need to label yourself. So it's better not to use these labels, because we don't understand their seriousness. These are for us, for mental health professional, anxiety, depression. It's, you don't have to use them. You just know that there is a conflict from the past or in the present that can be resolved, and you'll be fine. You just need to take help to resolve that conflict, and it's simply that simple. So for, just don't get trapped into the medical terms and labels and all that things. So if you want me to make more videos about any topic that you think you don't know and you want to explore more in simple layman language, then let me know in the comment section below. Until then, take care, be happy, and enjoy life. Bye bye.